totally different presentation. I was already thinking about how you want to, or how we can spread the message about this. I hope you allow me first the question, so do you train now others? Because I was thinking when you made this exercise do you train others, and which kind of education you really need to practice this with parents, or also maybe with team members. I mean, one thing is with the parents, but also team members sometimes come into the unit and have negative feelings or are overwhelmed or stressed. So is this something where you train others to do this, or what kind of background you need to be able to train others or to do this?
Yeah, I think all of the above is excellent suggestions. We're not there yet. That study was done just before, it was completed just before COVID. And so COVID screwed everything, as you all know. So, but yeah, those are excellent directions that we could take, because you really want to spread and give access to that simple tool. No, everybody is already mindful. We just need to kind of really increase our skills to become a little more mindful. So yeah, absolutely.
Just related with that, we are very lucky in our hospital. We have a psychologist who went with Kabat-Zinn to train, and she gives us, for the professionals, a mindfulness. I really like it because we are very stressed people working in the NICU, and you go home and you continue stress with your family. So they have a very nice mobile application that is called REM, and that is mindfulness to come home. So you can do it when in the way going home from the hospital, just to start going home in a different way. And we love the program, so we do our first professional in the neonatal unit. We make a mindfulness program, just only 4 sessions before the pandemic, and we have many people from the neonatal NICU, nurses, as nurses assistant and doctors that want to go, but we only can take like 25 persons, and because of the COVID pandemic, we have to stop it. But it's very important also, not only for parents, for professionals. Thank you. Very nice presentation.
Thank you.
Are there any questions from the audience? Here is one, Mandy.
Hello. Hi, I have a question with regards to the mindfulness study. I'm here. I think you might have answered already by saying that it needs to be tailored, but do you think that you would have been as successful if you had done a workshop for the group of moms instead of a one-to-one session?
Yeah, so I didn't mention that, but we were coming from trying for 2 years, I think, to have the moms to do a workshop. And our biggest barrier was to have the mom to leave the bedside, to go in a room or something to reach the workshop. So having that knowledge from the trial and errors that we did, that's why we said like, oh, the moms are available when we do the Kangaroo Mindful Care. Okay, it's more resources because you have to do one-on-one. But still, this is why we decided to do it that way. And it was quite successful to do it that way, and it was not successful at all to try to do groups. We had so many problems, having the moms to leave their babies when they're already coming just for a short amount of time. Yeah, but thanks for your question.
In line with the question that made the audience, I practice mindfulness and yoga habitually, and some months ago, we started a study in which professionals have to do mindfulness practice. The first idea that appears in my mind is, here I have no time.
Yeah, so so that's really common. That's the same for everyone, not just health professional. Everyone is busy. Everyone tries their best in life. But I guess like whenever you want to change a habit, you have to kind of do something to learn, and you have to commit oneself to learning, and that's time commitment. But the key thing with mindfulness is that you go about your life, experiencing life every single second of your life, and then you can bring mindfulness to those moments. So you may not realize, but I'm practicing mindfulness, I'm giving my talk, I'm having a mindfulness practice in the background, just informing me as I'm going around. So I don't need to kind of have a sign, mindfulness happening here. but you can do that. So you can do mindfulness while you drive your car home, while you commute in the transportation, while you eat food, while you go shopping. There's no limit to when you can bring it. But you have to start somewhere. And that's the place that it takes some time. Agree, yeah.
Maybe the people can say their names so that the audience or the speakers know who you are. That would be great. So Mandy, yeah. Oh, that's here beyond. Yeah. Go ahead.
Anyone? Okay. My name is Björn. Okay.
No, because Mandy was
I try to be
first.
mindful. I really like this exercise, and I think that's something that I need. And I try to post this comment mindful now. But also, we have talked a lot about systems, and I'm really appreciative of your presentation, because I think what your initiative here is fantastic, and to try to make a systems change in this program is fantastically good. We have been working like that since the beginning of the 2000. So we published, the Stockholm Family Center Care Trial 2010, and that was actually we're not so well organized, but many of these things we spontaneously tested, and as you know, we got very good results regarding parental health and shortness, morbidity, and also length of stay. But I'd like you to expand a little bit about how to professionalize parents, because that is something that we actually thought was a little bit challenging, how to mindfully approach parents. You talked, maybe I didn't really get it, but sometimes you talked about grouping parents in your unit, because we, of course, met many parents that actually couldn't really handle to do all the things. And some were actually quite offended by having to do all the nursing stuff. What we felt so important, and we still do, is to emphasize that you are a parent. And especially some fathers became very skilled in doing things. They became very task-oriented and not so much relationship-based when performing the tasks. So I think that's one thing that we need to keep in mind from our experience. The other comment I had is also the training of the parents, and I've heard from the training centers in Australia, for example, that some of the FiCare units, they said, we need some professional help, and you showed that Inga Warren, for example, was present in one of the pictures. So, of course, you need to have some professional skills and competencies when you train parents, and maybe you could comment on that too. Thank you. Thank you. I'm really impressed, and I think this could actually make a big, big change. I'm not opposed to FiCare, absolutely not.
Thank you for your comments, because are very pertinent. When we start to do the project, we didn't realize how high information do we have to do for the parents. Is this enough, or is just less information, not professionalized parents? And we realized that we have many, many different parents. So we have parents that need all these informations, and they got it. We make with them like a training map. Independent of the parents, we decide which things they are going to read. They don't have to read everything. But we have parents, engineering parents, for example, that they read everything and they correct things and like to have all this information. But then we have other parents that they prefer to start with the many basic things and slow down, and we will see. Sometimes if the baby gets very sick, imagine, or the baby is waiting for a cardiac surgery, at the beginning they start the program, and then the cardiac surgery goes, and we have like 40, 32 days, very unstable, very critical. They have to put the program a little bit low. We ask in an open, empathetic way, what do you want to do today? You want just stay here with us, not doing anything. That's perfect. They were not the responsible to do the things for the baby they don't want to. They have to be facilitators for the nurses to do everything. They were not alone, because sometimes when we start the program, some parents were concerned about, I have to do everything, the nurses don't do anything. So we have this concern with these things. So we manage just, we have to modulate all the program all the time. We have to readapt. And of course, be very, very respectful with the parents' wishes. And this is difficult, like the communication skills. I think for the young doctors and nurses, it's easy to take a catheter, it's easy to intubate a baby, but the communication with a family that is in a stressful situation is the most difficult thing. It depends that your tools, the person that you have in front, how is the baby now? So these things I think we have to manage, and now with the international program, it's an issue because we have many, many cultural differences that we have to adapt to all the things. So this is a big challenge. Thank you for your comments.
Hello. Well, it's just a comment about the timing thing. Like the problem of mindfulness is that we are not having time to do it or just playing the parents. And as you were talking, I have been thinking when I was working in the NICU, and I think a good moment, maybe you have also think about it, is when you are containing the baby, because with premature babies, they need contention. So I think that is a good moment that you are there and you can also do some mindfulness. It was just that comment. And thank you for your presentation. They have been amazing. Thank you.
And please, can you introduce yourself, who you are always?
Yeah, I'm Rebecca. I'm a pediatric nurse. Thank you.
Thank you.
Hi. Well, shall I introduce myself? Juan here. Thank you. Question for all the speakers, please. I enjoyed it a lot, and now I'm full-time back into teaching in medical schools, and I was trying to figure out medical students, residents, nurse students around. How is it working? Are they interacting? Are they being just witness? Are they taken apart? The rotation is very high, so it is time consuming, etc., etc. Have you considered simulation systems and asking veteran parents to play the role of training patients? Any ideas about that? Any experience?
Just in my case, in the School of Medicine, I didn't have any material in which they teach me to have any communication skill. After I started my actual practicing here in my hospital, I joined to a private course related to communication skills. I can confess you that it's the best course in my life that I have ever had. But unfortunately, it's something that I have to do apart from. After that, I think it's a matter of the culture of the unit. If the medical resident see that you make importance some communication skill, they imitate you and try to adapt this communication skill to themselves.
I thought that at the university there are some communications training, and also they are working with simulation. We have a unit of simulation, but sometimes it's things that are very technical, and we ask for a communication simulation training. Just a situation that when you have a baby that has a pathological disease just from birth that is not expected, this is a great a challenge how to inform the family. So we need more simulation situation for students and for doctors and for everybody. I mean.
Do you do kind of clinical rounds with students while you're training the parents, or they are kept apart?
When we make the about communication related in general. They were invited, but they were not there. They can share, they were there at the hospital and they can join all the workshops that they want. The workshops for parents are open for everybody who want to go.
Nevertheless, I have to confess that sometimes it's not only a matter of young medicals, but also for young, older professionals. We are really habituated to give information, but not to receive information. When you go to a room, maybe the first question is not, is how do you feel? What are your worries today? And it's not, I am here and I'm going to tell you what are my worries, how is your baby? No, first, listen to family. Explore what they want to know, to feel.
I guess what also is important for parents is also the body language and the place where you talk to the parents. And if you are prepared for a bad news, and you're never prepared for bad news, but how do you organize this also? And so that you have enough time and that you not get the information in stress. And so a diagnose opening I had once with Lucas ROP2, and then just this young assistant calls through the floor and said, oh, and by the way, we found out that he had an ROP2 today, but don't worry, we talked to this with you on Monday. Of course, this is not the way how you should get a diagnosis of your child, but maybe you say, oh, it's not happening in your unit anymore. I tell you, that happens, and not maybe with you, maybe, but it happens everywhere still today. And so this is something, it's the place, it is the way, your body language. So if we are sitting and you talk from up to down. So it's a lot of things what needs to be taken, I guess, into account. And what we recommend with our standards is really a proper education, what you have done, because it's not only learning from the older one or from the team, it's really also the professional communication, that's body language, that's the place, that's the talk, how you talk. So it's many, many more things. And this is why a professional education, even in the curricula, it should be, this is our wish, be implemented that when you become a neonatologist or a neonatal nurse, I guess if you become a doctor or a nurse, whatever you study, you should learn how to communicate with the patient. That's, I guess, absolutely key, what needs to be done. And not only communicating, you talk with the whole body. That's it. I guess this is what we recommend in our standards. Yeah.
Hello. My name is Annemarie. I'm from the Netherlands, and I have a question about the mindful kangaroo care. What do you think about yoga or breathing exercise? Do you think it has the same effect on the mother, or is it a matter of personal attention that makes the mom feel better?
Yeah, so I'm biased because I'm a mindfulness coach and not a yoga coach. Or
yeah. But maybe it's a thing, but it's a special attention. You give the mother special attention.
Yeah,
maybe.
For sure. You can do so many exercises that increases your level of mindfulness, because in a way, when you're mindful, you're concentrated on a task, you're clear about what's going on in that task, and you're also able to not hang on too tightly on the sensation or the sensory events. So if you do yoga, you do breath exercises or things like that, actually helps that. But it's the same when you play music. The more you play music, you become more mindful in a way because you develop skills. Those skills are transferable from one life activity to another. So eventually everything helps. But I guess to your question, like whatever works for the person, for sure. But I guess it's hard to do yoga with your baby born at 23 weeks.
I am a mother of a preemie, and he was born after 25 weeks. So I kangaroo care for 4 months, so I know
Yeah, I know.
a little
no.
bit. No,
I'm just
I know
being
how
funny,
it is.
but yeah.
So, but it helps me to focus on my child, to feel his breathing, his smell
Yeah.
him.
Yeah. And then what surprised me, so maybe to extrapolate on your question, what surprised me when I did my first week exercise with mothers, that many moms were not really attuned to their own body sensations, and they just needed to kind of like have someone to direct them there and to just open up to their own body sensation to say, oh yeah, I'm actually experiencing all of that. But some mothers are very, very attuned to their own body sensation. So there's a wide variety of people with, so maybe in your experience that you were already really familiar with those sensations. So for you, that's not kind of a big deal, but for others it might be. So yeah, thanks for your comments. I really appreciate it. Yeah.
I just have a comment about teaching and parental presence, because, and maybe for the ones who weren't here on, I think it was Monday, we had a workshop on, I showed a picture that when you do the rounds with the families, it's extremely important that you are sitting on the same level, eye level. And now, when I started neonatology, it wasn't that difficult because all the parents were standing. But now the parents are sitting skin to skin. So what I did when I was active, I brought a small stool. Even if there was a large number of students and other doctors and nurses, the parents didn't matter if they stood. But when I sat down with them, with a stool and talked, and we have, in the family rooms, we had the records on laptops. So it was very easy to inform them with having the laptop in your own lap, and you can show them sitting down, having a conversation. And another thing that I think is very important, another thing I'd like to point out, that of course students are extremely important to have around during the rounds, but you shouldn't have too complicated discussions during the rounds. You have to do those afterwards. Of course, you have to be sensitive.
A very, very thought-provoking session. I really learned a lot. And it's always good to be connected with the parents, and that's what we do in our practice. I come from India. I'm Dr. Deepa Bankar, and we have not so enough resources. But I would just like to share what we do for a very low birth weight baby who is going to be, when the patient comes on day 1, we have that, preparedness that this is a long stay neonate. So be connected with the parents. And when we initiate Kangaroo Mother Care, we ensure that not just one, but we have 3 Kangaroo Mother Care providers, or KMC providers, and we counsel mother for KMC in presence of mother-in-law or her husband, so that she has enough support. So ensuring family support right from the beginning when we anticipate a long stay of that very low birth weight newborn in our setup, and then the mother feels a sharing of responsibility because for very low birth weight, when they're going to stay for 30 days, 40 days, they are fine initially, very attentive, very involved when we teach them. But then at certain point, they start losing with some complications or some morbidities, or even with the stable course, they start getting frustrated sometimes because of the hormonal changes or whatever. So sustained counseling in a very low birth weight infant is very, very important. And that's what we always feel, that 24 hours KMC is very good for baby, but we never, of course, we should also know that the mother should have enough support to have 24 hours Kangaroo Mother Care. And in Bogota, I had presented a poster, and that's what we do. We prescribe KMC rather than advise Kangaroo Mother Care. And to father, we say that you give 2 hours Kangaroo Mother Care before going for work and after coming from work. So then he knows, because he can't decide when to give, so we decide for him that when do you have time and you give. The mother-in-law or any other provider, we tell them that can you come for 2 hours and give one session. So we divided sessions in 1 hour, and then we tell mother that you have to give 2-hour session 3 times a day or 4 times a day. Then she doesn't take it as, oh, I have to sit for 8 hours. She just thinks that I have to give 2-hour session 3 times a day. So this is our approach in my own country, and sometimes just by putting hand on shoulder of the mother, we just tell her that, how do you feel? And if we find that she's sad, we tell her that you can shout at us, you can scream at us, tell us about your worries, don't just feel. And she starts crying, and what we observe, the next day her breast milk output is, it increases significantly, because maybe she was subclinically experiencing some anxiety, apprehension, or maybe she was just sad with the hormonal fluctuations. So just wanted to share experience. We don't have the studies, but these are the prescription study I have. But again, I wanted to ask how to publish in a journal, because we don't get any grant. We can't pay 1,500 euros when one euro is our 100 rupees. So that's another concern, that our studies, our experiences, it's very difficult to put it at that level of open access journal where we can share our experiences. But a very nice discussion. Thank you so much.
Thank you for sharing.
Hello, my name is Ana Riverola. I'm a neonatologist in Barcelona. And thank you for your wonderful job, all of you, sorry. And I would like to share with you, I'm a NIDCAP certified, and I perform observations in my unit. And there is one thing that has been commented here, and it's like a little concerning for me, because I have been looking, observing parents taking care of the baby. Also nurses, of course, and observing the baby. But when I observe the parents, the co-regulation that family does with the baby goes sometimes in a second term, and they begin to do tasks, and they begin to do things, and they are not aware of what the baby is saying or asking. And I ask to myself, this is very important, because we are trying to teach parents to do things, and if I myself as a mother, if my daughter has 4 years and has to go to surgery, I would like to be with her all the time, kissing her and saying good words to her and giving my love and co-regulating her, but not trying to put an intravenous line. Or we have to know where do we have to arrive. And perhaps parents, if you ask them, they will say, yes, we want to do it. But the line between co-regulation and love that these babies need, and the task is very small, and we have to be aware of this. I don't know if I make myself understand.
Yeah, you are right. I mean, you are right. We have to realize our parents, and we want them like parents, but they want also to participate in care of their own baby. You have to ask if they want to. And I understand that perhaps you have in mind that some tasks are not indicated, are not well for the baby if you are a NIDCAP person. So we have like a training or a map related with gestational age, just to see how to do things in a proper way, just to respect the maturation, so not doing everything at the same moment, not doing in different like a scale. I mean, not from the beginning everything, and also respectful for the parents and the care. But as an example, I have a very good friend who have a 32 weeks baby, who doesn't have any big complications, and she couldn't bath her own baby until the baby has 1 year old. So this is something that is not acceptable. I mean, they spend with us many, many days. We have to give them the opportunity to take care also of their own baby. So
I totally agree with you, because at the beginning of the implementation of our program in the unit, one of the things that parents feedback us is that they feel examinated. So it's important when you offer the area of care that you are working with, that the words that you accompany the task in this case. First things first is to take care of the children.
I would also have a comment, because we talk a lot about the mothers, and what I really find important is that we, of course, ask the mother how she is, but also how the father is. And what fathers have, and this is what I always get from my husband to share with you guys, is that he says, when you as a nurse, or because you are a very female community, he would never share this with a nurse or a female doctor, or he never would have shared it with them. He would love to, would one time be asked from a male doctor how he is, and not in front of everyone else, but taking him in a room and asking, how are you? Nobody has asked him until, I don't know, ever, how he was, how he felt as I was in intensive care unit, as our daughter died. Nobody asked. Only some people from our community asked then why he is not the old Oliver as he was before our children were born. And so maybe also an advice or tip for you, it is of course important to ask us how we are, but we also have to be, with the communication, sensitive that, and this is also communication, and this is why communication training is so important. A man maybe, I even believe mainly, would not share his feelings in a way to a female doctor, female nurse, as it would be to a male. So please take this also into account, because when they are not supported, and this is what happened to us, is that my husband got a very severe depression and even a tinnitus, and was not, and still today I'm allowed to share all these things, I'm allowed to share pictures, I'm giving even talks for fathers, even being a mom, because he cannot talk to this. He gives no interviews, not at all. He cannot talk about the death of our daughter. He cannot talk about the time in the NICU. He can even not talk about how he is today to others, even when he is doing his master at the moment on university. Even that is something what he cannot talk without losing the words and start to cry. And this is something what just have in mind, that when we talk about parents' involvement, that parents are both, and a father is not a second-class parent. That is so important, because in this pandemic, we still isolate the fathers and give them 2 days, maybe 3 hours, where they can visit the child. Again, parents are no visitors. That one thing, I guess the majority have understood it, but it's also the father. And they suffer lifelong, and many of our community colleagues are divorced because of they cannot handle this in the rest of their life. So this is why it's important. This is why always when I talk for the fathers as well, because I speak for my husband who cannot speak anymore, cannot speak at all about this. Yeah, Björn.
So true. And your both comments, I was thinking about fathers and mothers. They are, of course, different. And I was very impressed by your, did you call it activity books with the different stages the parents go through, the competencies of the parents? Yeah. Because we had very similar planes. I saw it when I visited your unit, and I said, well, that's exactly what we had. Anyway, talking about fathers, because when I used those, it was we made a line so that each parent, mother first or father, who doesn't matter who did it first, but both had an individual line. And you didn't examine them, you discussed with them. Yeah. And then you together, you said, where are you at the moment? And you have one line for the mother and one line for the father, because one of those pages is, of course, how are you doing? How do you feel? And that could be a way to start a conversation, both with the father individually, but also with the mother and the father together with you, or the nurse rather, not often, I mean, the doctor or the nurse. So I think it's important to distinguish that we are different and we are in different pages. And both parents are going to take care of the infants when they come home. So, yeah.
I can remember now a situation some months ago in which two families were admitted in two different single-family rooms. One of them, there was in the unit several weeks with very sick children, and in the other one it was a newborn. The next day, the father of the first family went to the father of the second family to support the parents. He was the only person that supported this parent because the whole team was focused on the mother.
I don't know how, now it's working. I think the problem is that during our studies in the medical faculty, we don't learn absolutely. No one of our teachers talked to us about communication, the importance, the abilities of the communication, and never ever to talk about empathy. No, never. So we grow up in the faculty as little doctors that pretend to know everything, that think that we will cure, we will save the people. And so we grow up arrogant. I have been working as a medical doctor in different countries, South America, Central America, Africa, here in Europe, Eastern countries, and I noticed the same pattern, the same way you're walking in the hospital with all the things, no, the phonendoscopio, otoscopio, the white, no, dress. I mean, all these instruments, all these things, of course, there are barriers with the patient, with the mother, with the father, with the child who is ill, no? Because we show power. We show that we have the knowledge, no? And many people think really, people, minorities and people who are stigmatized in the society, they see us as a messias, I don't know. So I think it's a reflection. We must all, not only medical doctors, but all the health personnel, know about our behavior, about our physical expression when we are treating our patients. Thank you.
Thank you. You cannot give something that you do not have. So to conduct a session on mindfulness, I suggest you also conduct a similar session to the NICU nurses, doctors, because you cannot give that kind of feeling to your mothers if you do not have it in your heart. So please consider the healthcare providers as well. Thank you.
Yeah, that was a very, very good comment, and this is also why we discussed before how we can help the nurses and doctors to be mindful for themselves when they have such a stressful job, and also having in the end this huge lack of human resources in the NICUs and still then fighting every day for not only surviving but also for thriving of our children. I would like to not stand up, please, close the session with maybe making one round of how you are planning, I would say, for the next 10 years, what you have presented today, where you want to be in the next 10 years, because I'm a visionary, as many of you know in the meanwhile, and where you want to be with your programs in 10 years, because I hope you all go home then later today and bring all this knowledge, these feelings, this spirit of this conference home, so where you want to be with this beautiful program in 10 years.
Well, it's difficult to answer this question. I have said previously, it's a young but alive program. I think that we are starting, we are proving the program with our parents, and we have to enrich with experience. I don't know, but what I know is that parents are going to teach us to enrich our programs.
Great. Marta?
For me, I have to say that I have like a pre-professional phase and a post-professional phase from the Bogota Kangaroo Mother Care conference 4 years ago, because I realized that we have to change the way that we do medicine. We were very technical professionals, and this sometimes when you have an age is enough, and I like the way that we are doing now medicine with the parents and with the more humanized neonatology. I like that way.
So where do you want to be in 10 years?
So because of the international project, I'm very happy with that, with sharing experience. So I would like to travel. My family, I don't know if they want to, but I think it's very enrichment to share the experience from one to another. So this is something that I like very much.
Yeah, thank you. Mark?
Okay, I was going to make a joke, but I'll just be serious. So I think I want to kind of continue helping mothers and fathers in their connection and regulation with the baby. So I try to kind of navigate around that. And also to your comment, I do take the healthcare practitioners really seriously. I teach medical students and residents mindfulness and doctors as well.
Mike?
We're shut down.
Yeah.
Oh, no battery. Okay, let's start again. Oh, yeah, I can hear my voice now. Yeah. Okay. So in 10 years, I want to continue working with the mothers and the fathers in the co-regulation that they do around the time of birth with babies. And also, I took her comment really seriously because I do teach mindfulness to medical students and residents and physicians. So I want to continue doing that because I see the value in helping. I think it's helped tremendously for communication. On a personal note, I discovered throughout the years of my mindfulness training that my empathy has increased tremendously, not only for others, but for myself as well. So, yeah.
So I hope everyone from you go home today.
For you, Silke?
Yes,
Sorry.
this is for me, is that when you are going home, that you bring this, as you said, to the world, the different kind of programs, but the spirit, what we have here. And also to understand that one is the emotion, but the other is the fact. We need to convince not this community, we need to convince and to change the mind of the community, of the scientists, of the people who are not sitting here. And my dream is that we implement this in the next 10 years, that parents are no visitors, that parents feel and not tell that they are grateful to be allowed to be in the NICU, that they are not only partners, maybe that's the first step, but that they feel they are the parents of this child. And I hope that in 10 years, when I'm then 60, coming back, and hopefully meanwhile we see us on many conferences, that my son then, with 35 years at this time, can say, yes, what my mom did and what all these neonatologists and nurses did made a difference. And this is maybe worse that I was born preterm. Thank you very much, and I see you in half an hour back.